Hi, a very good evening to all of you. I welcome you once again in yet another interesting episode of Eclectica today. Today, we have a very special person, Dr. Sheth from uh, the Fried's Institute of Human Genetics, Ahmedabad. Let me introduce my guest and then I will bring on my guest and I'll tell you that what exactly we are going to discuss today. See, with this COVID, now, every people, not only clinicians, doctors, scientists, RT-PCR is a word which everybody is using. Genomics is a word which everybody, whether they know or don't know, they have been seeing it in social media. They have seen about mutations. So these are all very scientific things. So today we will understand from Dr. Hirsch in a very, very simple way that what exactly these things are and how all these technologies today has become the present and the future of clinical diagnostics. So before going calling in my guest, I just want to tell that how influential person we have as my guest today, and I'm very happy about it. So Dr. Harsh's area of expertise includes next generation sequencing, computational biology, cancer prevention, male infertility, rare disease diagnostics, molecular epidemiology, and personalized medicine. You might have read these things inside research papers or seen posters presented in conferences, but today Dr. Harsh is here to explain everything to you. Apart from this, Dr. Harsh is a member of different professional bodies, national and internationally, and he has 24 scholarship or research grants since 2008, totaling over rupees 5 crores. He has 31 peer-reviewed publications in international journals. He's also contributed two book chapters on cancer prevention and lysosomal storage disorder diagnosis and management. Dr. Harsh also got one worldwide patent on NGS-based MSI assay and one patent filed on SMMIP-based SNV and CNV detection. So he's a very versatile person, and apart from that, he's academician by heart. So he trains a lot of students from different backgrounds, like BSc, MSc, MBBS students every year. So he has led for Fried GSB TM Finishing School program, and which provides up to 4 months hands-on wet lab training to almost 30 students per year, and he had three PhD students, two in India, one in UK. So it's time to see our esteemed guest today. Welcome, Dr. Hirsch, and thank you so much for accepting my invitation to Eclectica. And thank you so much. It's very good to see you.
Thank you, Dr. Gargi, for the generous invitation to be here. It's a pleasure to be here today.
Okay, so today I will shoot a lot of questions to you, and I think it will be a very interesting conversation for me as well as for all my audience.
Indeed, please.
Fine. So Dr. Harsh, like as I was mentioning while I started this program, that today RT-PCR, genomics, these are something even layman people tell is not any more a word or a sentence for a scientific community only, or a educated community who are specialized in this area. So just that I know that your specialization is in genomics. So I would like to understand, and if you can explain my audience that what exactly genomics is, if we really bring it up in a layman terms.
I think that's quite an interesting introduction that you gave to genomics. Come to think of it, the word DNA in itself became really popular because of
Hmm.
COVID. I mean, every now and again, people would now know. Okay, we are talking about DNA or RNA, what type of vaccine it is,
Right.
even what type of test it is. I mean, if I use the word PCR, everybody now knows what is a PCR, even though they don't know the mechanism, but they do know what it does in a sense.
Correct.
So we have to thank COVID to that to some extent. But genomics as a word or as a branch is actually quite big because it encompasses ways to look at your DNA from multiple different angles. Essentially, what it does is it looks at the blueprint of life, and the blueprint is the DNA in itself. And there are multiple levels at which you can look at the blueprint. You can look at from a very, very broad standpoint in a dedicated field in genomics, which is known as cytogenetics. You essentially looks at sticks like figures, which are called chromosomes. And if there's something really wrong with them, that's the way to do it. You can then go one level deeper to see that if a particular region of your DNA is missing, or if that region has an extra copy. So that field actually came into being somewhere in late 90s, early 2000, and now we are in the era where genomics revolution per se has really taken things by storm, whereby we are able to read every single letter of our DNA. I mean, come to think of it, in
True.
early 2000 in itself, to
Mm.
read 3 billion letters of your DNA, it would take years and it would cost more than $1 billion to do so. 20 years down the line, we are now able to do that in a couple of days at a cost of $1,000 or 1 lakh rupees. That's substantial uh, advancement that has happened. And all of this, it comes under the umbrella of genomics now. And there is much, much more to it. It's much bigger field than we could have ever imagined. But essentially, at its heart, it's the way to look at the DNA and to understand why somebody has a problem or why something is happening to someone.
Thank you so much for that answer. And it's very clearly explained. And I think anybody who would listen to this answer would really understand what exactly genomics is all about. And well, so since we are talking about importance of adapting genomics in clinical diagnostics, so in that context, this is my observation. Just my personal observation, I would like to share, and then I would be my question to you in the same direction that in the past few years there has been a genomic boom already that has happened not only in the western world but it has happened in India in terms of say industrial development commercialization of tests, but still I think that it is still a gray area for most healthcare professionals. So what is your opinion on this, or what do you think about it?
So, to give you an analogy to understand what is happening, essentially, if you look at the way things developed in Europe or in the Western world, you had typewriters, then came computers, then came laptops, then came tablets, right? So there was a gradual succession of technologies coming through one after the other.
True.
But the way things have happened in India is just 10 years ago, you used to write notes by a pen on a piece of paper. And now suddenly you're dealing with laptops, you have mobile phones, you have tablets all over the place. So
Hmm.
all those small advancements in
Hmm.
between desktop, you made a massive leap all of a sudden. That's exactly what happened by the introduction of genomics in healthcare. Come to think of it, 20 years ago, the best you could ever do was to look at chromosomes of people and
Correct.
see whether those large bits of DNA are being passed down the generation, and they are the reasons behind a given disease. But now the
Hmm.
world has moved on so quickly, and the medical education, even though genomics is pervasive across the entire medical fraternity, be it
Hmm.
pathology or oncology or any field, even dentistry per se,
Hmm.
even though it's pervasive, its adaptation has been challenging because of the massive shift and pace at which things have happened. In a sense, genomics is what you would call a disruptive technology. It has changed the
True.
way you carry out medicine, right? So,
Absolutely.
so
Absolutely.
it's not a major surprise that it has caught people off guard. Earlier, doctors used to carry stethoscope around their
Hmm.
neck.
Hmm.
Now they have laptops and few other gadgets, and that sort of a paradigm shift takes a while to get entrenched in any given domain.
Hmm.
So essentially, what we are looking at is the start of genomics revolution taking foothold in India. But given enough time, it will become pervasive across the
Hmm.
domains, and things would start to get much better.
Hmm. Yes, I agree to you because I think it's about the sudden shift, as you said, and it is about the sudden advancement of technology, and lot of knowledge and information has come all of a sudden together. So I think with time it will become more digestible, and clinicians will start adopting. They have already started it, but I think it will be more widespread, as
Indeed,
you said. Yes,
indeed.
yes. So, Dr. Hirsch, we hear a lot about genomics when it comes to rare genetic disorder diagnosis, and lot is happening also. But what I was trying to understand, that what is your opinion about using genomic technologies routinely for clinical diagnostics in different sectors of medicine and healthcare?
So, rare disease diagnostics. So, these are essentially disorders that occur very rare in the population. You're talking about 1 in 10,000 people would
Mhm.
have a given disease, and that's why they're termed rare diseases. And this is where genomic technologies really came to the forefront, because all of a sudden you now had a chance to view the entire DNA sequence to try and understand where things might have gone wrong, whether a single letter got changed or it's missing or there's an extra copy of it, and a whole set of other things. And this is where it really got foothold, and it captured the imagination. But there is one branch of medicine where it has really been a game changer, is oncology. Because
Yes.
every medicine nowadays that is being prescribed to a patient is dependent upon the genetic makeup of the tumor, be it lung cancer, be it oral cancer, or colorectal cancer, or even breast cancer, in fact.
Right.
All of the cancers that we see today need to have a genetic workup so that the doctor can decide which medicine to give. And that's happening even in neurology as well. There is a special branch of medicine called pharmacogenetics to know whether, if you are going to take a drug called carbamazepine,
Hmm.
and you have a genetic mutation in you, you can end up with a really deadly outcome known as Steven Johnson syndrome.
Right.
So you want to do you want to get tested for that mutation before you take that anti-epileptic drug.
Hmm.
It's better than going to the hospital bleeding out of your eye and nose and ears. It's a nasty disease. You even have different branches of medicine in neurology, whereby you are absolutely fine till 20, 30 years of your life, and suddenly in the fourth decade of life you start having tremors in your hand and you're not able to speak properly. These are telltale signs that there is something going on. And when you start to see the family history, you see that you were not the only one. There were other people who had similar problems
Right.
as well.
Right.
So, be it neurology, be it oncology, even gynecology. Gynecology has been really good at adapting this technology, because that's
Yes.
one area where you can really prevent the disease from coming in the first place. If a disease has been running in the family, then gynecologists can test whether whether the fetus has a given mutation or not,
Correct.
and in
Correct.
doing so can guide the patient whether they would want to continue with the pregnancy or what other options they have. IVF is a really good example of that nowadays with the latest set of technologies that are coming through. So, in fact, it is genomics that is leading revolution in all of these different branches of medicine now. We are not just diagnosing diseases anymore, we are treating them, we are doing personalized treatment now, and we are coming to the point of preventing these diseases across these different disciplines. So it's actually a very exciting time to be a doctor right now,
True. Very true.
no matter what branch of medicine you are in.
Yes, yes, absolutely, absolutely. I agree to it very much. In this context, like I would like to understand from you that now a lot of companies have come up, like you said, that now diseases really can be predicted, and accordingly, uh, the treatment plan or maybe some modifications can happen. I mean, can be done so that the person at least gets buys some healthy years. So, in that context, what we see is that many disease predictability tests have come up in the market that uses genomics. So, the question that arises very obviously is that um, are these tests really reliable, and what would opine in this aspect as an expert?
So essentially, you're asking two questions for one, because there are two types of test categories that are offered commercially, and it's
Mm-hmm.
down to personal choice, to ethical questions, and even scientific integrity at the end of the day.
Mm.
So let's take one example right now. So you have tests that help you to predict whether you're likely to have breast cancer down the line,
Right.
or you're likely to get some sort of disease for which there is treatment available. In
Mm.
fact, there are worldwide guidelines now that suggest that if you are getting married, and in your area there are certain diseases that are very, very common, of course getting tested for those diseases is a good idea, especially if you're marrying within the same community, because
Mm.
it helps you to not only know whether you're carrier of this disease, more importantly, if you know that you're likely to get a given disease, you can go for surveillance programs, and that disease can be prevented. The one of the best examples of that is Angelina Jolie herself in
Yes.
2013. A big news came out saying that she had mutation in her BRCA1 gene, and therefore she
Correct.
went for a preventative surgery, and now and her risk of breast cancer was therefore reduced quite dramatically. So you
Mm.
have those type of tests that are not only scientifically sound, but they are meaningful ethically as well, because you're actively preventing diseases in a given person or in next generation, which is
True.
good. But then you have set of diseases that are predictive in the sense that they tell you have 10% chance or 20% chance of
Mm.
getting Alzheimer's down the line. Now
Mm.
that's not really helpful, because if you are not used to dealing with uncertainties in life, I mean, at the end of the day, I always like to be certain about what I'm going to get.
Mm-hmm.
Then those sort of tests become very challenging. In fact, there are few companies that are offer it, but when a patient receives, or when a person receives that report, then it's very difficult for that person to understand what does 10% be, 20% be.
Right.
These are very small numbers,
Mm.
and that creates a lot of anxiety for them.
Correct.
A third type of test, which has certainly gained foothold, is how what sort of food you should eat, or
Mm.
what type of food you should eat,
Correct.
and or what exercise would be best for you. Now, these lifestyle related tests can be very, very difficult to explain, because a huge part of the data from which these tests are derived come from European or American populations. And
True.
ethnically or genetically, we are rather different. Our eating styles are different. Our living styles are different.
Mm.
So it's kind of like when you're using that test, you're comparing apples with oranges. And if you're not careful, then you are essentially comparing something that shouldn't be they are not comparable,
Mm.
and therefore you may actually end up giving an advice that could be harmful for someone.
Mm.
So if somebody is going for a test like this, they really need to speak with the test provider, where what sort of data that they have underlying, that they are using to provide such predictions.
Correct.
Otherwise it can become harmful for you down the line.
Thank you for that all those very important insights, and I think we are getting a lot of clarity from you, and whatever the running myths are, and what exactly the actual scenario is. So I know that you are a very passionate academician, Dr. Harsh. So in that context, I would like to understand that as academicians and researchers, what should be our ideal role in taking this field of genomics forward? What do you think about this?
I think there are two ways to look into it. One is a technological standpoint, and one is more of a pure research standpoint,
Hmm.
or translational standpoint, to be more precise. So the
Hmm.
very first standpoint that we take is a technological standpoint. And what it takes into account is how can we push the envelope of the technology that we have right now? Could we make it cheaper? Essentially, it's a bit like I have a Windows laptop right now. Can I
Hmm.
add a bit more RAM to it? Could I add a better CPU to it for it to become cheaper, for it to become more powerful? And those sort of technological leaps are excellent to have, because at the end of the day it helps to drive the costs lower in the long term, and therefore it makes things affordable for people. in the long term. But the thing is, these technological leaps initially they used to take very short amount of time. I mean, genomics is so far is the only field I know that has broken Moore's law,
Yeah.
not only in terms of the speed at which things advanced, but the dramatic reduction in cost it took. But that
Yes.
sort of curve has started to flatten now. We are
Hmm.
now tracking along Moore's line again.
Hmm.
So we have come to a stage whereby we need to start asking meaningful translational questions with the technology that we have right now. And this is the juncture that I personally take very seriously. Because
Hmm.
what it means is we have gone from asking, hey, can I make things more powerful, to saying, can I make this more meaningful for
Hmm.
people on the
Hmm.
street right now? And a huge part of what I do and what my team does right now
Hmm.
at the Institute is to make technology that is developed in India by Indians and for Indian population. Because that way you can truly make things affordable for people. And not only that, even if you're doing drug development programs, if you're doing treatment programs, if you're doing prevention programs or surveillance programs,
Hmm.
you now have so many groups across India, they have started doing that. Because all of a sudden we realize that we have reached that technological peak. It's
Hmm.
now come to a point whereby we need to start applying in
Hmm.
routine practice. So that paradigm shift has again started to shift again, has started to shift again because it's about application. And this is where you would see India starting to take a lead, because it's you're talking about dealing with the second largest population in the world, and
Correct.
and there are and there are several diseases, there are several unique features that we can learn, that we can adapt as we go
Hmm.
along. So asking meaningful questions is the way to go forward, in my humble opinion, I must say.
I think you speak my mind. I mean, I absolutely agree what you say, and I think uh, a translation of the translation into clinical benefit for the people, or any other type of benefit. I think that is where lies the essence of any field of science. Absolutely, the same happens with what we are talking about today. But I think for any field of science, when there is translation for the benefit of the society, I think that's where the success lies. So
Indeed, and even it's a 5%, 10% gain.
yes,
You may
yes.
think it is very small, but a common Joe on the street, for them a 10% gain is substantial.
Substantial, yes. Correct, correct. Dr. Hirsch, like when I was introducing you, we came to know that you conduct some academic courses. So, if you can please tell us more about your courses in this field, upcoming, if there are any upcoming courses that you are conducting, and how exactly any enthusiast can get inside, what is the procedure? It would be very nice.
So at our institute at least, we conduct a whole variety of courses. So starting with workshops. So these are meant for clinicians or researchers that are quite along the way in the field of research or
Hmm.
clinical or the clinical work, and they're designed to provide knowledge and hands-on experience of utilizing the technology in their routine clinical practice or in their research. So we have a workshop that is going to take place in February next year
Okay.
on something like this. It's part of a conference, national conference that we conduct each year on Rare Disease Day in February, and this workshop is going to be a part of that. We are just about to start advertising this
Hmm.
workshop.
Okay.
We Every year we also do training courses that are dedicated purely for students in the field of biomedical sciences. So it doesn't matter if you are a biotechnology student or a genetics student or a pharmacy student. As I
Mm-hmm.
said, because genetics is pervasive across all of those disciplines, this training program that goes on for 4 months is a hands-on program. So you come to the institute, you're here for 4 months, and every day you are learning the technology. You're actually using the technology by yourself and understanding nuances of how it can help you down the line to probably gain, say, better employment. You might want to do PhD further on, or you might want to use this technique in a completely different field. So I had a student, an MBBS student, who got really enthused by learning statistical methods that we were teaching at the institute, and it turns
mm,
out he now uses those same statistical techniques for as a difference analyst for US in the US. So all of these techniques are transferable. So that course we run twice a year. Our next
okay.
batch is starting from January. In fact, we have advertised that. And then we have a dedicated diploma course purely for clinicians who
Okay.
are in a public healthcare setting in India. So these may be MBBS or MD students, and they are very keen to gain experience in genomics and have a project
Mm,
by themselves. They want to lead a project. Then
mm,
they spent 6 months at the institute and they do this hands on. And it's not, and such courses are not only just run by us. You have courses being run at ICMR NIRRCH in Mumbai.
yes.
You
Yes.
have it being run by IGIB in Delhi. You have
I know.
courses being run in Manipal and Chennai, and you name it. These
Mm,
courses are dotted all over the place.
correct.
Essentially, every state you would find a course that
Mm,
would be useful for you, and every course would have certain nuances about them.
true.
But it's important to gain these courses because it takes you beyond what you are taught in the classroom or in your textbook, and you get to
Exactly.
understand them better.
Exactly.
I mean,
Exactly.
even at this age, I just went for a course
Mm,
in Italy to learn techniques that were developed more than 60 years ago. But it turns out, surprisingly, they're still very, very useful in clinical practice.
right. Right.
So it's good to
I
stay updated.
Correct, correct, absolutely. I think learning should be always lifelong. There is no age. There's no age to learning. I mean, at least I believe that very much, and I think
Absolutely.
I am a living example when I talk about my academics that way. Well, so just that a related question. I think you already answered a bit of it, but still, I would like to ask that you about your course is that. Or maybe related to this is that suppose today if a dental or a medical student or even a professional wants to make a career in the field of genomics, is that possible, and is that possible?
Absolutely, absolutely. It doesn't, like I said, it doesn't matter if you
Hmm.
are a biotechnology student, if you're a pharmacy student, if you are a medical student, or even a dental student. Because
Hmm.
genomics, even now, if you get trained in genomics, doesn't mean that you end up working in the lab and becoming a professor down the line. It could also
Exactly.
mean that you could do an MBA, you could start up your own company, you could be a manufacturer of products that are utilized by genomics companies. You could be an IP lawyer,
Hmm.
because IP requires you to have understanding of that given field.
Yes.
So you could
Yes.
be an IP lawyer as well, or you could even be a science communicator. There are
Hmm.
wonderful science communication streams being run in India. I know for a fact that Dr. Karishma Kaushik, for example, based at Savitribai Phule University, she runs excellent science communication workshops every week
Oh,
for young kids called Talk to a Scientist. Wonderful
fantastic.
recipes. You have wonderful science communication programs being run by India
Hmm.
Bioscience as well.
Yes.
So
Yes.
you have all of these fields to explore. And it doesn't mean that if you're an IP lawyer, you can't be something else. You can
Some-
be open to all of these things now.
Correct, correct. I mean, that's the essence of being interdisciplinary, and that is what something
Exactly.
I love about science. Coming to the concluding part of our conversation, it's very painful to leave you, but I think since we have a restriction of time, or I think
Sure.
we both can speak hours and hours together.
Of
But
course.
just that let our audience get more enlightened through your message. So, what would be your message to the aspiring healthcare professionals and future scientists in adapting genomics in clinical diagnostics?
I think the message is loud and clear at this point that genomics is coming, and it's coming at the speed of one day Bharat Express, right? So
Right.
whether you like it or not, you would have to learn at least the basics of it and
Hmm.
see how you can use this technology in your healthcare, in your research, in public engagement, in any field that you like. It is coming, and it is here now.
Yes.
Um, and if you can save a life of a patient, if you can save a life of a child, or make a drug, or in fact make a vaccine, like COVID was a wonderful example. We ended up making vaccine. We, when I say researchers and scientists across the world, ended up making vaccine in a year. I'm sure we can use this technology in India to make things, to make vaccines, to make drugs, to do better diagnostics, and to understand the beautiful nature around us at large.
Thank you, Dr. Harsh. It was wonderful talking to you, and it's very inspiring. And we all got energized with your positive energy and all the information, important insights that you have shared. And I think if you can mention the website where people can go and watch, I mean, learn more about your institute and the courses that you run, it will be very helpful. And also for my audience, once this live session is over, I'll put all the details in the description of this video so you can
Sure.
get an access.
So essentially, anybody who wants to learn about the courses or the activities or even workshops that we conduct, please go to www.geneticscenter.org, and you will find all the details there. And of course, if you have any queries, please feel free to email me or call me, and I'll be very happy to help you as well.
Thank you, Dr. Harsh, for your time, and it was wonderful meeting you and knowing all these things from you. Thank you once again.
Same here, Dr. Gargi. Pleasure meeting you, and take good care. Thank you.
Good night. Take care, everybody. Thank you.